Happy Child Life Month, my friends. I am so happy and excited to be with you. It is the first week of Child Life Month, which is the month of March. And traditionally, if you're a child life specialist, we spend the whole month making sure that others know what our job is. But here at Child Life on Call, we want you to know how grateful we are that you show up to work every day. Parents, that you ask questions with this Child Life community, that you find benefits from the tips and suggestions that we put out there on social media. So this is just a big hug from me here at Child Life on Call to you to say Happy Child Life Month. And we wanted to give back to all of you who listen to the Child Life on Call podcast. We know you're child life specialists. We know that you are parents, and we also know that you are child life students. So I'm so excited to tell you that if you are a child life specialist who has been wanting to join the Child Life Circle, you have been wanting to find a place online where you can connect with other child life specialists, get PDUs that are not crazy expensive, get access to virtual clinical supervision. You can do all of that for just $19.99 a month. I know it sounds very inexpensive, too good to be true, but I promise it is not. Actually, just during the month of March, sign up with no strings attached for free for 7 days. Come try out the circle, see what you think. We would love to meet you there. We have lunch bunches. We have fun conversations going. We share resources with one another. We ask great questions. So child life specialists, come join us during the month of March, 7 days completely for free. And we would love to have you there as a member. Parents, we haven't forgot about you either. Last year, we launched our How to Prepare, Support, and Respond to Your Child During SHOTS course. The feedback we got from parents was incredible. They felt empowered. They initially had tools as soon as they left the course to go support their child and advocate for them. And we want you to have that course. We are having it available during the month of March for 50% off. So if you go to childlifeoncall.com/shots, and when you type in the coupon code March, 50% off, no questions asked, but make sure you get it because this deal and this course will not last forever. And lastly, child life students, if you're listening, we have partnered with some of the best mentors in the field, your child life coach, your child life guide, AJ and Lauren. And if you come get a child life student service through us and you type in the coupon code March, then you get 10% off any of your services this month. So come join us. We would love to have you there. Okay, let's get to the fun, exciting part of our conversation today. And true child life fashion. Of course, we're going to have a child life specialist here for Child Life Month, but we're going to be talking about parents. Elise Cofer is the lead researcher and child life specialist behind the new article, Fitting the Pieces Together, the experiences of caregivers of children with medical complexity. Elise is a certified child life specialist out of Vanderbilt, and she and I talked today. I couldn't be more obsessed with this topic. As you all know, my heart and my passion is supporting parents of children who have an illness or a medical condition or have children who are hospitalized, and making sure that the parent experiences are not only just a part of their own community, but that healthcare clinicians and workers and providers understand the important needs and perspectives of caregivers. So I'm so excited and can't wait to jump into it today. Happy Child Life Month, friends. I'm so glad that you're here. Hello, my friends. Welcome to Child Life on Call. This podcast is a safe place for parents to share their stories about what it's like to have a child that has a medical experience, diagnosis, disease, and or everything in between. We know there's power in sharing stories, and that power multiplies when you can listen to other parents who have walked a similar path to yours. Giving and getting advice is great, but hearing how another parent navigates the complexities and nuances of healthcare is even better. As a child life specialist, my role is to support, validate, and provide emotionally safe spaces for kids and their families, and I am so honored to be on this journey with you. In addition to parent stories, we sprinkle in some expert episodes every now and again that have content for both parents and professionals in the field of healthcare, all with the mission to empower parents to be confident advocates and partners with the care team during healthcare experiences. We're so glad you're here.
My name's Elise. I have been a child life specialist for almost 2 years. I'm from Nashville. I love it here. I was born and raised, and I stayed in the South for my undergrad and then did my graduate degree here at Vanderbilt. And now I work at Vanderbilt. So kind of a full circle child life career so far.
I love it.
Yes. Yeah, I do too. Everything kind of fell into place, and I love being here. And I work right now in the hematology oncology unit. So inpatient and outpatient, while also primarying patients in our infusion clinic. So not necessarily oncology patients, but people who are here with those chronic illnesses and coming regularly for their treatments.
That's a full load to have for sure.
Yes. Yeah,
Yes.
it is. It's, no 2 days are the same. It's great, and at the same time, our unit, there's an aspect of acute care too. So we get kind of a little bit of everything.
Yes. I remember feeling that way too. Like cross covering is hard and having to be in many different places can be difficult to manage because you're managing two different opinions about how child life works. You're managing two different care teams who may or may not know how you work. And so it can be really exhausting. Tell me some of your favorite parts of being a child life specialist. And I'm very interested. I got to hear you speak at the Child Life Conference last May in 2023 and was just blown away. We talked a little bit, I just feel like such a geek for your research and what you've uncovered, because so much of the sentiment is what we have heard parents report on this podcast. So tell me a little bit about, I guess, getting the cart before the horse, but your interest in caregivers and parents as it relates to being able to support their child and what you like the most about that child life work.
Yes. So getting to be a child life specialist, I feel like we all have our own very unique ways where we've learned about child life. And actually, the way that I learned about it, I have always loved working with children with medical complexity and developmental differences. So that's just kind of been my whole life. My mom was a special education teacher and a developmental therapist. So it was something that we all just kind of did growing up.
It's in your blood.
They were our friends. Yeah, exactly. Everybody, that was my life. That was normal. And so my original plan was to be to go into counseling and to work with families of children with medical complexity. And I had accepted a graduate program and ended up just taking a full stop. This is not exactly, I want to be working with this population, but somehow this isn't the context. And through many, many Google searches, found Child Life. And my graduate program was actually an interdisciplinary grant between pediatric healthcare and in severe disabilities. So my education background is in child development, got all of the Child Life courses, requirements done, and then while also kind of meshing in severe disabilities. And I got to do some really cool practicum experiences here in Nashville at some schools. I was at Tennessee School for the Blind. So it was just really interesting, and to be able to see how healthcare, plays into their life and vice versa. So that's, I don't know if that really answered the question, but
that definitely does.
Okay.
And what interesting experiences to guide you there, both personally and professionally and educationally, it seems to. So I have kind of I don't know that I know that when I was becoming a child life specialist many, many years ago, we definitely learned about caregiver support, right? And family support. And it wasn't until I became a parent myself that I really felt compelled to understand the parent experience more and find out how child life specialists could actually make a bigger impact for parents, more than just hey, how are you? Let me share with you what I'm doing, but really try to understand, validate. Do you feel like you were more appropriately prepared to support caregivers than I was many years ago? Or do you feel like you've learned more just in doing your research now than you ever did in your schooling to become a child life specialist?
I feel like in my schooling, I felt very just supported, and we were able to talk to parents. I remember actually we had a class, one of our hospitalized child class, and we had families actually come and talk about their healthcare experiences. So I do think that we had a basis of parent caregiver interventions, and emotional support and validation is a huge part of child life. But of course, you don't really we learn so much in school, but until you're doing it and you're seeing,
Mm-hmm.
wow, like this truly, this illness, these diagnoses are not just affecting this child. It's the parents, caregivers, family members. It's totally different. And no two families are the same. I do think this research I kind of had an idea. I'm like, okay, hopefully we can talk to some parents and caregivers. Honestly, the goal was to talk to 5. This research kind of came about during COVID when my student experiences were put on hold for like however long, 2.5 years. So I thought, let's do a research study with Dr. Jessica Bull. She helped get everything started, and we partnered with our complex care team here. The goal was 5. I was like, let's just see.
Wow.
And then we got 20, which was great. And just the depth of the interviews, and the purpose of this was, to be very open-ended. And I brought the questions that we asked if you were interested in hearing them.
Okay. Oh my gosh, yes. Tell me more.
So the purpose of this study was to, selfishly, I was thinking, in my head, I'm thinking, of course, there's a need for specific child life specialists. Maybe it's a community-based, maybe it's with a complex care team, but, just like we have surgery child life specialists, we have oncology child life specialists. Like,
I know where you're going. And yes.
And that's kind of, so, of course my research, I'm like, okay, we're not going to influence any answers, but that's kind of where my brain was going. So wanted to be very open-ended. And so there were a total of I have 8 questions, and depending on how the interview went, it was very casual, just kind of like this. So just to start off, I asked them to tell me about their child and who they are. And this was probably the question that took up the most amount of time. And I wish that I could have all the transcripts and to read them to you, because if you were reading it, say you overheard this conversation happening, you would never know that a parent or caregiver was describing a child with medical complexity. There was nothing, eventually we got to that point, but it was, tell me about your child. Oh, well, she loves to sing. She loves to dance. She loves music. Her favorite activity is XYZ. She loves her siblings. She's a cheerleader, all of these things that parents and caregivers were describing. And it just kind of set the tone for the interviews. And then we got into more about their diagnoses. So if there were any physical limitations or behavioral or emotional. So wanted to know just specific things that parents and caregivers associated with their child's diagnosis. Trying to piece together and to separate their needs, which it got a little bit gray, and a lot of these things kind of built upon each other. But what physical needs, what health needs, what health care do they have, and are these needs being consistently met? If they're being consistently met, where are they being met? Is it in a hospital setting? Is it at home? What I learned is that it's all at home. For the most, that's a generalization, but for the most part, most of the needs are being met at home, whether it's, I have to say this, the research was done during COVID. So a lot of things were being done more at home, but from the conversations, it seemed like that had been consistent across the board. Physical therapy, occupational therapy, while these are really important disciplines, even in the hospital setting, we know that patients are only seeing their physical therapist maybe an hour a day, if they're getting it every day, in a typical hospitalization. And it's the same for this population. So really, it's the parents and caregivers who are reinforcing these skills and working on them at home.
It really makes you realize, I'm just having so many thoughts that
please
parents,
interrupt me.
No, I don't mean to. I'm just what you're bringing out is just parents basically have to run a full-fledged hospital in their home 24/7 and don't get a choice about that, and have storage closets and have people coming in and out of their front door. And it really changes what home means for that family in so many ways. I think Lindsay, who is in operations here for Child Life on Call, is a mom of 2 medically complex children. And she's fine with me sharing one of them had a kidney transplant recently. And she is just now on the other end, like deboxing all of these things and taking all these old meds. And it's just so much about home, and medical complexity gets really confusing for families. And you have to imagine then when they come into the hospital and they don't get to run it like they normally do, that has got to be really disconcerting to be like, oh, I have to ask for this when normally I just walk to my closet and grab it.
And that's something that came up in our conversations. One thing I didn't realize is how, like, I don't know what the right word would be, whether it's non-inclusive, non-personalized. Like, there were families who said, I can't even use the formula that I use at home with the machines at the hospital. I'm like, wow, I had never thought of that, like your child's food source is different. And how do you're already in the hospital, likely because you don't feel well, and then you're not getting the same things that you get at home.
Really one day, I'm just going to put it out there that, you know how there's like a hospitalized child class for child life specialists. We're going to have the parent of a hospitalized child class.
Yes.
Okay, let's do it.
Let's do it. That's perfect. Sign me up.
Oh, I thought that you could just write the syllabus. I'll come in as a guest speaker like every other day or something like that. Not too much. Just kidding. Okay. Tell me more about your research and some of the things that you uncovered.
Yes. So I'm looking through here to see. So what we found through these interviews, most of them lasted upwards. I had one that lasted like an hour and a half because we just didn't cut it off. I wanted to hear everything, hear what people had to say. It seemed like a lot of parents had never had the opportunity to share their experiences. So a lot of people shared about home nursing and what like receiving home health care looks like. Some people had really positive experiences. Others noticed this really big gap in care that hopefully one day we can work towards making better. Let's see. Another thing that, people spoke a lot about financial limitations and cost of care and what that looks like within the home. My favorite question that I asked was our last one after, I talked to parents and I asked like, what supports do you have? And many people said that their life is 24/7 about their child. So that was something that I learned, that the community, while there is a robust community of these patients, some families shared that it felt so isolating that, maybe they've never met somebody else with the same diagnoses as their child. And just like so that's kind of why we said fitting the pieces together. Like, where do the pieces fit? How do we, in so many different environments in the hospital, at home, in the community. But my favorite question was, in a perfect world, what do you wish you had for your child and your family? And there were things as small as compression socks. I think I mentioned that at conference was somebody saying that, as their child grew, an infant size compression sock no longer fit, but an adult size compression sock didn't fit either. And there's a big gap here. Other people talked about, I wish that I could put in a heated pool at our house. She loves to swim, and the aquatic therapy that she does is so beneficial. So that was one of my favorite things that people shared. I'm trying to find
I love
list.
that. It's like the two bookend questions that you asked, like, tell me about your child. And, if you had I call it the magic wand question, right?
Yes.
If you could have anything, what would it look like? I'm so interested, Elise. I just did a post on, I guess yesterday, today's Tuesday. I did a post yesterday on Instagram talking about some of the myths of child life specialist. And one is that, we're only really appropriate for young kids. And that's kind of just because the care team sees us play a lot, right? The second one was that we're only really valuable for children who have long hospitalizations. And I've had families report this to me, that when they have a child with medical complexities or severe disabilities and they see a child life specialist enter the room with a light spinner and bubbles, and they go, oh my gosh, this lady this guy has no idea who my child is or what they need. And I have to agree with them, right? And what I often tell parents is sometimes we don't know the room we're walking into, what we're going to see, what we needed. Sometimes I literally hear something happening. I wipe my hands with sanitizer and come in and see how can I help. And I just happen to have those things there. Or I'm using those things as an assessment because I don't know your child. When I push this button, how do they react? And but there's a disconnect between parents who have probably a long mistrust of or experience with hospitalizations and a child life specialist who comes in trying to play, or so it seems like.
Yeah.
From your experience in your research and also as a child life specialist, what are some ways that child life specialists can walk in their room and maybe not immediately, but within the first couple of minutes, dispel the disconnect that parents feel when the child life specialist comes in? Does that make sense?
Yes, it does. And I actually was thinking about this because I think it's so accurate. I've had that happen before. I heard parents talk about that, and what I learned from this study, and I've kind of been implementing it when I can in my practice, but that very first question of tell me about your child. Tell me what makes her happy, what makes her smile. I had somebody the other day tell me, well, yesterday was a good day. Today is not so much a good day. And I said, well, tell me about what does a good day look like? Like what kind of makes that a good day? Because this patient, and then it came out that she loved music, and I was able to, collaborate with our music therapist to provide that support. So maybe it's not that I will provide the direct patient intervention, but through my parent and caregiver intervention, I'm able to assess what is helpful and then bridge the gap that way. Because otherwise, there hadn't been a consult placed yet. So, I was able to give them a little bit of rapport and meet that need. But I think coming in, explaining who you are, hi, my name's Elise. I'm a child life specialist. I'm here as part of the medical team and here as an extra support to you and your family. Tell me a little bit about Katie and what makes her happy. Tell me about what she loves, what's something that's hard, and what helps when things are hard. How can I help her in this environment, in these scenarios? And then that usually opens up a conversation with families and kind of creates that dialogue, so I can ask more about, well, tell me what she does at home. What does a typical day at home look like? Do we have brothers or sisters? Do we love animals? Can we get the facility dog here? Have we been in the hospital before? Tell me what that's looked like. And I can still ask the same assessment questions. Hard things like how do we do with pokes? What about invasive procedures? But not to come out the get-go, to put the emphasis on family as the expert of their child.
I love that. And you're not walking in assuming that you know what the next best thing is. You're asking the parent for their input so you can really be the guide, not the expert, in helping them get through what's coming next and what's happening now.
Yes. Yeah. And I feel like in my experience, that's kind of helps to build trust. And then I can prepare parents a lot of times. So if I had a patient who was medically complex and also had like a new oncology diagnosis, right? Like I can then prepare the parents, show them, and then kind of let them be the person that's who their child trusts. Their child knows them better than me. And if it's more appropriate to come from them, I'm all for it.
Yeah. Yeah. I love an egoless child life specialist. I don't know if egoless is a word, but it's the true, right? Like we have some insight about what happens here at the hospital, and you are the ultimate expert. And how can the two of us work together to help you through this transition? What's happening now? And maybe even some skills for later on in terms of learning how to advocate and feel empowered. And it's just so exciting that maybe the next few times when this family comes in, you get to knock on the door and you see them thriving and you see them asking for what they want. And maybe you're a part of that plan and maybe you're not. It's really exciting.
Mm-hmm. And I will say, speaking of advocating, that was a big theme that came up throughout this research was families who, if they had a newborn and learning how to advocate for what they needed at home. And as they grew older, some people talked about the school system, but truly learning that it's okay to advocate for your child, and that's part of our job too, is to help parents and families know, like, you are the expert. We are meeting you and your child in this one place at this one time, but you've had years of experience. Like, please tell me about her or him, so that we can provide the care that they need.
That's amazing. Well, I know that you are a gap filler, and I love gap fillers. So people who see things that have holes or could be better and want to challenge the status quo of why are we doing it this way? Could we perhaps do it this way? And maybe you don't know the right answer yet, but you're wanting to fill that gap. So I'm going to ask you the same question that you asked families at the end, which is what do you need and what does your magic wand look like for you as Elise, the child life specialist in our profession? If you could fill a gap, what would it be?
I think the gap that I would try to fill is providing more education for child life specialists and for also just the healthcare team as a greater whole. It's not just, our profession that we don't necessarily always get specific training and experiences with this population, but also, there's research to suggest that medical providers oftentimes don't feel as well equipped to provide care. So I think I'd also empower the medical team as a whole to approach, meeting a patient and family the same way we do of, tell me about your child. That would be the magic wand that everybody just knocks on the door with just an openness and to receive what the patient's family is telling them, to let them be heard. Because that was a theme that came up a lot, is not really feeling heard. So I think that would be a magic wand moment for me, if I could just make sure that every patient and family felt that way.
Yeah. I've asked this question 3 times now on this, side of the year of the podcast. And each answer always just comes with, honestly, education. And that more people have awareness and kindness and openness about other people's experiences.
Wow.
And whether we're talking about grief or we're talking about like severe special needs or medical complexities and the parent experience, it's just, it's not hard. And I feel like when you come and you speak about your research and we can put it on a podcast and share it with more people, you're doing your magic wand moment, which is pretty exciting. So I can't wait to see what else you do.
Well, thank you. And thank you for giving this research the platform to hopefully, educate other people and give a little bit of insight, not a lot, but.
Absolutely. Well, thank you so much for being here with us. Is there anything else you wanted to talk about in terms of your research or talk about in general that we missed?
No, I would love to hear if there are any parents and families who have thoughts about it or child life specialists. I'll definitely send you the article that has my email on it as well. And I would love to answer any questions or have continued conversations along the way. I'm always learning. I love to learn. So I want to hear from other people's experiences too.
Oh, I see you on a big stage at the American Academy of Pediatrics conference with some of my favorite rare disease moms and dads, just sharing experiences. So like, I know there's a lot more for you to come and I can't wait to learn from it.
Oh, well, thank you again so much for having me. And I'm so honored to be part of your podcast.
Yay, me too. I'm so happy.
Thank you all so much for listening to Child Life on Call. If you head to our website, childlifeoncall.com, you're going to find all sorts of stuff there for parents, professionals, healthcare providers, child life specialists, no matter who you are. Actually, when you just go to our homepage, it'll help you direct to exactly where you need to go. On that, you'll find opportunities and PDUs for child life specialists, parents. We've got a starter kit for you, and clinicians. We even have a clinician course, which teaches you how to be a confident and capable caregiver in pediatrics. We're so grateful that you're here. Please DM us on Instagram. And like I mentioned, when you rate and review this podcast, it helps other families be able to find us. So let's keep doing that. And I will see you again here next week.